if you're going to really discriminate who you should be going to, it's an orthodontic surgeon who 100% of the time does orthodontic surgery. All I do is jaw correction surgery for the treatment of people with small jaws, and they also want to look amazingly amazing, and they never want to wear a splint. They want to stop snoring. They want the brain fog to lift. They simply want to delete these 10 other diseases that everybody thinks they've got. They haven't got 10 diseases. They've got one disease. They've got a small jaw. They want it gone.
What can we do to save wisdom teeth in young people? That's the $1,000,000 question.
Well, I'll put it to you this way, because I treat a lot of kids. I say, I tell you what, you're looking at my 32 jelly beans there. You can have as many of them as you want, but they all have to go in the glass. And deliberately, there are 8 red jelly beans that can't fit in the glass. And I go, are you happy with that as an outcome, that you only got 24 jelly beans? And they go, well, Paul, you only gave me the small jar. Why don't you give me the big one and we'll play the game again? So I give them the big glass. Now they've got 32 jelly beans in one jar. And they go, I get to take this home. And I go, and that's how IMDO works.
Wow.
Yeah.
Well, someone told me that third molar removal is a multi-billion-dollar industry.
It drove the opioid crisis. All those people, how do they get addicted to opiates?
Post-surgery.
And the commonest operation, wisdom teeth.
Third molars.
They were given overprescriptions for their wisdom teeth surgery. That was the big driver for it.
Really?
It's a terrible story. We're globally stuck with the opioid epidemic that all started because you had corporates that knew how to make a profit from a drug that they didn't have any way to sell or market, apart from the misrepresentation of its use.
But then, does that mean that there's always going to be this entrenched resistance to true airway health?
Obviously.
I'm glad we finally had a chance to connect, Doctor. We've been trying to set this interview up for over a year, and last year it fell through. I'll take responsibility for that. I didn't feel at the time that I was going to be able to get sufficiently prepared for the interview. You had sent me a chapter of your textbook on jaw surgery, and I never got around to reading it. Of course, I would love to read it. I'm sure it's a gold mine of knowledge and information. But this year we reconnected and decided to just sort of lower the stakes and just get together and chat. And so, that's what we're doing.
Oh, I just think it's an amazing opportunity to meet you. You've got such a presence, and you're a voice for probably both sides of the fence, aren't you? So for the patients and for the surgeons themselves. Well done.
Thank you. Yeah, initially I was definitely just a voice for the patients, but this year especially, I've sort of taken on the subject of helping doctors teach patients how to be better patients, if that makes sense. There was a big issue that was happening in the MARPE, MSE, doctor-patient relationship world where patients were coming in with, from the internet and sort of creeping out the doctors, asking too many questions in an inappropriate way. Not that you can't ask questions, of course you can, but they were coming in and throwing all these red flags, and then doctors were getting back to me and saying, hey, look, I'm having to turn away these patients. I don't want any more of these patients because of, their personality as they approach me in the initial consult. And so I did an interview with Dr. Ting where we sort of talked about the more appropriate way or skillful way for patients to approach their doctors if they want to get some of these jaw augmentation procedures done. And so you're right, though. I try to function as like a mediator between patient and doctor in the airway jaw expansion space.
Well, there are two languages within the universality of English, and you've got how doctors talk and how they know how to promote or describe what they do, and of course the language that we have amongst surgeons, and then somehow you'll be the translator into a different language, which is the layman's point of view. And there's certainly a community conversation going on about jaw surgery. It's been going on been building now for, I'd say, for the last 12, 13 years. Prior to that, there wasn't an audience for the discussion. Um, uh, I've just been, you know, patsy to it. um,
Sure.
certainly I get people making conversational inquiries about me in forums and so forth. But I don't read them, um, but like the other surgeons, you hear that conversations are taking place.
Yeah. Well, I think if there's conversations taking place about you, that just means that you're one of the A-list providers that people care about and that people are surveying other patients about to, make sure that they're the real deal. So I would take it as a compliment if I were you. Everyone gets mixed things said about them, but what's the saying? Uh, if they're hating on you, it just means you're doing something right. Is really the bottom line, And I
Hope,
don't know that they are hating on you. By the way, I don't read the stuff people say about me online either. If I did,
well,
I would be in a psych ward because some of my early work where I posted my progress photos with some of my early expanders are pretty grotesque. And in the forums, people being anonymous posters do not shy away from telling the blunt truth. So, um,
yeah,
you know,
yeah.
you gotta take it on the chin and move on, I guess. Just
Well, it's a funny phenomenon that you can be a plastic surgeon and talk about breast augmentation and put on a picture of breasts or bums or whatever, but it's you can anonymize it simply by cutting the head off, but you can't do that with facial surgery, and so those commentators, um, where they're being very critical of whatever surgical result um, talking about, uh, they're real people. They wake up in the morning, they look at the same face in the mirror, and there's this whole commentary of negativity or positivity centering on their face. It's an terrible conversation to have, especially if you're not, you know, um, given permission for the conversation to take place.
yeah, yeah. What's your experience been with patients coming to you from your YouTube channel? You have your own YouTube channel, Dr. Paul Coceancig, where you display cases and discuss, your
Well,
IMDO procedure and hmm.
you know that YouTube channel just started as um, putting up videos of my kids, and and uh, because I figured out how to use it, not one of my colleagues had. Um, uh, you put up videos to explain to individuals, people who are real, the real patients. You say, well, this is going to explain your surgery. I'm going to spend some time and do a bit of video editing, which I've practiced on with the holiday experiences with the kids on cruises or whatever. And I'll make a video and try to explain it to you in a way that you can explain it to your family. And you put up a video, and you get not one person watching it or 10, you get 1,000,
Sure.
and you think, who are the other 999 people?
Hmm.
And every time you put up a video, but then it becomes its own animal, um, where people say, I want a video for myself. I want a video to explain this process or that. And you find out now it's 2,000 or 3,000, and the people that are sharing it are other surgeons, or their patients of other surgeons sharing it with their own family to explain what's going to be happening back home. So that's how it grew. And then I got so upset because it was a YouTube channel for my kids.
All right.
This year, this year. So I left it. I didn't touch it for years. And I used to just get hassled by Google to, can I become a YouTuber or something? You monetize it. And I ignored it, and then YouTube threatened to take it down unless I signed monetization agreements. So I didn't know what it meant, but they've been putting advertising on it, and so some of the videos are getting up to several million hits. I just flabbergasted by.
Yeah.
So it was just, it wasn't deliberate on my part. It was just all for the privileged enjoyment of specific individuals to help them, navigate a journey, a personal journey themselves. And some of them then would say, "Look, can you put up? I really, if I hadn't met you, Paul, I'd be living with whatever I had. Can you use me as an example, maybe to explain it to other people?" And that's called charity and the gift of doing that. It wasn't trying to be a celebrity or anything.
Mm.
Um, and so at one point I got a bunch of 10 people. They said, do you want me to put you before and after, and you'd be in a sequence? And they did that. And that video, went really very well. And then people started copying the video. They lifted it and put it on their own channel.
Yeah.
And then people would go to the other bloke who would say, I can get those same results as Paul, but I won't use surgery. I'll use um, orthodontics, or I'll use
Yeah.
plates or such stuff. And
Yeah. What a
and
joke,
then
huh?
and then we get those patients coming to us saying, I only had that treatment with that guy because I watched your video. I go, my video, I'm a surgeon. Why didn't you come to me in the first place? And it just goes on like that. But it's just background fluff.
Yeah.
Been going on
Yeah.
for decades.
Sure. Yeah, my channel is actually similar. It started with me just um, sort of just documenting my experience with an expander back in 2016 and then 2017, and then someone just started sharing that in a Facebook group, and
Mm,
it just sort of took off, I guess, from there. And next thing I knew, I found myself being treated as some sort of authority figure in the space. I was the guy people started coming to with questions, and then I guess I adopted the persona of being the person who was to report on the state of the market of jaw expanders,
mm,
and so I never intended to become a journalist in this space. But yeah, with when you have YouTube essentially turning all 7 billion people on the planet into your potential audience, the sky really is the limit with how far it can reach. And then with this subject matter of becoming more beautiful and curing sleep disordered breathing, with that being a huge problem, that those are two problems that many people are dealing with.
mm.
Obviously, our channels are going to just continue to grow as more and more people come online and realize that they're suffering from these issues that can be fixed.
Yeah, it's such a big disease, sleep apnea. There are many different um, diseases that affect the face, um, but uh, but because the face is attached to the head and it's the top of an airway column, and that airway column requires us to drive uh, oxygenated blood to the rest of us. It's all interconnected, and I'm always I don't know if you ever watched House, uh, the
Doc,
series,
Dr. Greg House.
Dr. Greg House, and I'm paraphrasing, but he said there's no such thing as someone winning the lottery twice, and there's no such thing as someone having two diagnoses, and because the diagnosis is rare, um, and if you're having three diagnoses, there's something going wrong. And all these people that probably talk to you, and certainly they talk to me. Every doctor that they've ever seen has given them a diagnosis, and the next one another diagnosis, and the next another. And uh, it just cut out then. Um, So if you're having multiple diagnoses from different doctors, it's the pigeonholing that they're trying to put you in relative to their craft group. And medicine, dentistry, physiotherapy, speech pathology, podiatry, uh, everyone will make a claim that their particular treatments uh, will will have some effect on some other part of you, but not really understanding how that other part will be affected.
Hmm.
And so orthodontists will say, I can improve your breathing by putting a plate in, and you think, okay, all right, you might have to explain that one to me. And to a scientist and a surgeon, um, which is my formal training, I get a different conversation than a layperson. But of course, within a forum, we're all the same, and we're not discriminating in a forum on the basis of uh, how many degrees or what background experiences you've got. You're simply an anonymous name with an opinion, and and maybe just like a Donald Trump rally, it's the loudest person that wins. But that's not the way it is in science and the way it is in medicine. You really have to find the smartest guy in the room and just sit and listen.
Mm.
And if you don't understand the language, there are more formal ways of informing yourself, just like buying a book, the book that you haven't read
Yeah, yeah.
yet, uh, or as you say, people watch YouTube videos. So, but hopefully the information that's being imparted is given by the wise and the knowledgeable, not by the populists and the agitators, as it were.
Yeah, what misinformation in the airway jaw expansion space do you find to be sort of the most nefarious or dangerous? Maybe I can lend my opinion just so you sort of know where I'm going with this. I think that what's worse than the misdiagnosis of sleep disordered breathing in small jaws
Mm.
is the correct diagnosis of small jaws, but then the prescription of the wrong treatment. So, for
Of
example,
of the CPAP and the jaw splints. And
n-
so,
n- not even those things. I mean, those things are, I agree, are band-aids, but to me, what's really uh,
mm.
dangerous and what I'm here to sort of advise against are the tooth-borne expanders. You know,
I, they're silly things.
they are, and here in the United States, we have these sort of self-labeled so-called TMJ dentists, and they're fantastic at diagnosing. They always identify the small airway and the small
Mm,
jaws, but then instead of offering a really solid treatment, some sort of skeletal expander or a jaw surgery, they're
mm,
having patients put in these big acrylic blocks into their mouth and then just pushing out on teeth. Or there's
mm,
this the AGA appliance that's been totally debunked over the past
mm.
year. Um, so, what are your thoughts on all that?
Well, if I, well, it's a bit of a loaded question because every word I say will insult someone. Yeah. So if I have a headache, if I have a headache, and I see a podiatrist who gives people insoles for their shoes, they'll argue that the insole for their shoe will fix my headache. And if I go to a GP with a headache, they'll give me a pill, paracetamol, acetaminophen, Nurofen, or whatever. If I go to a neurosurgeon with a headache, he'll take a CT, he'll look inside my brain, he'll eradicate or dismiss or look for and exclude 100,000 diagnoses. And if he finds my brain tumor and cuts it out and I'm free of a headache, the podiatrist will say, I knew my insole that I gave you would work. Right?
Mm-hmm. Mm-hmm.
And that's the reason, the fundamental behind that is because I went to the podiatrist. I chose, my insights made me ask a podiatrist to fix my headache. And of course, the podiatrist can't be blamed for offering an insole because that's what they do. So if you go into a dentist with a complex problem and they say, well, I'm going to look at you through the lens of my dental expertise, and my dental expertise is limited by the expression of giving you something like an expander or a jaw splint or a piece of acrylic over your teeth, you can't blame them for doing that because you're the one who invited that treatment. And that criticism is also applied to surgeons. You know, surgeons will say, well, I have to operate because you're coming to me, I'm a surgeon. I'm there to offer a surgical cure. And so everybody else who's not a surgeon will say, well, he's a surgeon. You know, that's all he does. He's buttonholing you into a surgical therapy where if you had come to me, I could have given you a piece of acrylic in your mouth. And that therein lies, you know, the eternal debate, which is, does this work versus this? But really the driver for it is the person, the individual with the condition.
Mm.
And my counsel for that is, well, you find the bloke who's a surgeon, a brain surgeon, and as a podiatrist, and as a GP. And if they're all three, they're going to say, well, if I thought the foot sole would have worked for you, I would have done it because I'm a podiatrist. If I thought the pill was going to help your headache, I would have done it because I'm a GP. But I'm also a surgeon, which a podiatrist isn't, and the GP isn't either. And because I'm a surgeon, I'm going to CT your brain and I'm just going to exclude 1,000 other things that you've never heard of. And if you've got a brain tumor, by the way, I'm pretty good at removing them. And that's the kind of guy that you want to go and see if you're going to have a complex facial condition as well. You really want to go up the tree a little bit and have them control your interactions with the dentist, the orthodontist, whoever else, rather than have them lead what the smartest guy in the room should be doing for you right at the start. Does that make sense?
Yeah. Yeah. So you're saying that you need someone at the top of the food chain quarterbacking the treatment and someone who
Yeah,
has a broader understanding. But who would that
that's a
be?
good analogy. Yeah,
Who would that be in this space? You think that's a surgeon, a jaw
that's always
surgeon?
going to be a surgeon. Yeah, and it's going to be a surgeon who's done medicine, right? It's going to be a bloke who's done dentistry. It's going to be a bloke who's done engineering. It's going to be a bloke who's done orthodontics. It's going to be a bloke who's been a GP. It's going to be a bloke who's been a father. It's going to be a bloke who's not just straight out of college and never been married. It's going to be, you know, a mature bloke or woman at the top of the food chain because you're already at the top of the food chain of your own body. You are the one suffering the disease. And if you don't get it fixed, you're the one that's going to die from that condition. So that relationship of having disproportional faces and this expression ultimately of sleep apnea, which is dissociated. If you see a sleep physician, they're not there to diagnose your small jaw. They're just there to say, yeah, here's a sleep study that says you're suffocating 30 times an hour. They're not there to understand how the tongue and the small jaw is contributing to that flat tire that you're having 30 times an hour. They don't know about it. All they know is how to inflate it, you know, with a bicycle pump that goes on and off 14 times a minute. Um, that's not a cure, as you said, it's a Band-Aid. And having a jaw splint, which holds your jaw forward and pulls your tongue forward, so it's lifting the tongue off the back of your airway as you're lying on your back at night, that's going to destroy your jaw joints. It destroys your bite. And if there's an argument that splints can move teeth and widen jaws by pushing teeth apart, wearing that acrylic splint which is exactly the same splint anyway, will move your teeth if you're using that acrylic splint to hold your whole jaw forward.
Mm.
So, so really, if you really think about it, the ability to market the single appliance, a piece of plastic on your teeth, and have it give 10 different outcomes, all of which almost run counter to each other, and it's the same appliance. Um, it's a furphy.
Mm.
It just doesn't work. You know,
Mm-hmm.
if it did work, it would work 100% of the time in 100% of people for 100% of conditions. But it doesn't, and that's why there's that debate that you're reflecting upon in that forum, in those forum communities. Um, you know, it's just a lie,
Yeah.
and it should, you know, um, and people say, oh yeah, but it's conservative. You know, it does no harm. We trialed it. We saw it didn't work. Now they can have surgery. It's like, yeah, but you still got your money for giving that. You still tortured someone with that splint for however long it took you to decide that, in fact, it would never have worked. And I've seen these splints. They literally push the teeth out of bone. Um, you know, in adults, in children, if you've got professionals doing it and they have ways of monitoring that it's going well, you can certainly expand the upper jaw. You can't expand the lower jaw. It's just not possible. And that idea that it somehow has some effect on the nasal airway, well, that's just marketing.
Yeah. What do you think about um, like the skeletal expanders and their role in this whole world of airway correction and jaw augmentation? I'm thinking of the MSE, the custom
Yeah,
Marpies.
well, if you look at my YouTube channel,
Mm-hmm.
right, and it's an old one, I animated using real CTs of people how much nasal airway expansion you got with doing a skeletal expansion. I did that before everyone did that and even had a clue that that was even possible. And I animated it, and that was the root number one. That was the number one video on YouTube to explain that. It was the first one. Yeah.
Mm-hmm.
So I can legitimately say that's it. That's me. Now, if I'm saying a lie, just give me a video that predates the video I put up on YouTube.
So, what was the thesis of that video, roughly?
It was explaining IMDO, you know, how I grew the lower jaw, and it explained the pre-treatment to IMDO, which was just expanding the narrow upper jaw. And as I expanded it, I measured the airways in the nasal column, and I showed how all the bones were buckling a little bit. And uh, in a 12 or 13-year-old kid. And so if you go back in time, you'll find that video. And I challenge you, and your viewers can be challenged to try to find a video that predates that.
Mm. So then, I take it you're not a fan then of nasomaxillary expanders. Is that safe to
In
say?
children, yes. In adults, it doesn't happen.
Mm. So, what's your
Now,
approach to widening maxillas? I think when people think of jaw surgery, they think of jaw surgery as advancing the jaws. You know, Bimax surgery, Lafort cuts, and BSSO
mm,
cuts, or even your IMDO procedure, which is sort of a mandibular advancement distraction procedure.
mm,
But people tend to think, you know, of the skeletal expanders like the MSE as providing the transverse expansion first.
right. Okay.
So
Yeah.
how do you,
Well,
because of course the transverse expansion helps to improve the nasal airway by splitting the roof of the mouth, excuse me, which is the floor of the nose. So
mm,
it's nice to get a little bit of that. What do you do about that?
Okay, well, you've got two holes. You separate them. There's still two holes. Don't get bigger. They're the same volume. You're just getting the stuff inside still occupies that volume.
Hmm. I don't understand. So you're saying that expanding the floor of the nose doesn't necessarily expand the nasal
Doesn't
breathing tubes?
doesn't do doesn't do anything. How can it? It's just imagination, right? For you to be able to fundamentally understand it, you'd have to take and not a cone beam, you'd have to take a CT scan. And a CT scan in a person that's lying on their back, not when they're awake and they're erect, because 12 hours of the day is spent on your back asleep, right?
Hmm.
You just count the minutes that you're lying on your back. Now, if you're going to fix, there are two holes, literally two nostrils. Now, they might be pinched, and you might say, well, I can hold them open like that, but it's still a potential space. You're not increasing tissues or anything like that. But past this wobbly thing on the end of your face is rigid structures. They're surrounded and imbibed and intruded by rigid structures. And in effect, you're just displacing those structures. The tubes remain the same.
Hmm. So
You just have to
expanding
think about it.
the
It doesn't do anything. It might widen the nostrils at the best, but that's even that's debatable.
So we have, for example, Dr. Casey Lee, who's doing the ease
Right.
procedure, where he's doing this posterior
Yeah.
nasomaxillary expansion, and he's showing charts that demonstrate improved nasal
So you're talking
airflow.
about your upper jaw is like this, and he's expanding the back.
Correct. It's right.
Is
What
that
some
what you're
people
saying?
refer
Yeah.
to as like a reverse cone type
Yeah.
of
Yeah.
expansion.
Yeah. Yeah. Oh, he calls it the ease, right? It's called a posterior SAMI, posterior surgical assisted rapid maxillary expansion. Right? Um, and you can give it a name, you can give it an acronym. It's just marketing. And I thoroughly explain it in my book. There's a whole chapter dedicated to it. And there is no other book that explains it all except my book, Six Ways to Design a Face, which you can buy off Amazon.
Hmm.
And it's internationally published. People who have jaw surgery, they buy that book. So it may open what we call the posterior choane, but all it really does is it stretches the soft palate. So the soft palate stretches out a little bit and it doesn't flap as much, but it doesn't open the airway behind the soft palate. So let's talk in analogies. We're better off to talk that way. If you've got a small upper jaw and all you're saying is that it's narrow, that's like you've got a little dog and saying it's short, right? But you're not going to say a little dog's short because it's got short legs. You're going to say it's small dog because it's got small legs, small body, small head, small tail. And if you're going to make that small dog a bigger dog, you've got to let it grow three-dimensionally. So it's not about expansion, it's about heightening and lengthening it as well. And the intimacy of knowledge of the anatomy that surrounds it's incredible. And so all of those structures you somehow got to keep, like furniture in a room. You don't want to throw the furniture away. You're wanting to make the room bigger to accommodate all the furniture so you can walk around the pieces of furniture, and that's your airway, I suppose. The simple idea that you can just expand is just a furphy.
Hmm.
It's certainly part of the equation, but it's nowhere near the entirety of the formula. In an algebraic series, A plus B plus C plus D and a whole alphabet, expanding the upper jaw would be the Z. And that's the only thing the dentist or orthodontist can do. But it is entirely not the whole equation.
So what would be some of the other dimensions that you might be able to affect as a surgeon? The A, the B, and the
Well,
C.
height, width, symmetry. So there might be one nostril that might not be able to breathe as well as the other side. Yeah. And you've got two airway columns. So expanding something, you think as you're pushing against each other that they evenly expand as well. That may not be the case. It may just that it expands preferentially on one side and a little bit on the other. Yeah. So the control over that expansion, and when you're looking at an upper jaw and you're looking at symmetry, you might have one side that's up. And sorry, I'm just in the mirror here. So you might say, well, to make it work, you do that. But the better way is just to split it and level one side and maybe widen it or tilt it or tip it just to, give it evenness and symmetry. But that's just talking about the teeth and the smile. But that also relates to the symmetry of the airflows that sit above the upper jaw. You call them your nostrils. And then, of course, you've got the air passage. It's, through the nostrils, lifting the nasal tip up a little bit, broadening the nasal base with the support of the bone behind it. You've got the whole upper jaw that's pulling the soft palate away from the back of your throat. And you're wanting to stretch that so it doesn't flap and vibrate and produce that horrible sound, And that's right. But then you've got the next block, which is just behind the tongue at the level of the epiglottis. And when you're lying on your back, that's what's collapsing and blocking your airway. And that's why you're lying on your side with your mouth open, breathing, because you're trying to relieve the obstruction behind your tongue. The moment you're breathing through your mouth, which you don't know you're doing because you're asleep, right? The moment you breathe through your mouth, you're no longer breathing through your nose anyway. So always the fundamental thing that you've got to fix is that thing that's happening behind your tongue, which is related to your small jaw. You've got to fix that first. Or that's your primary driver. You've got to relieve that original obstruction. That's the thing that's been there since you took your first breath after you were born. Yeah. And you just simply kept evolving and developing as the rest of you grew. It was always small relative to the rest of you. And then the secondary consequences of it, which is how your upper jaw is not grown properly, because you've been a chronic mouth breather, because you're obliged to breathe through your mouth because of your small jaw, the way that upper jaw is grown three-dimensionally has to be, corrected three-dimensionally. And you're not going to be able to assess that through a profile view. You're going to assess it because you've got very complicated technology, and the technology belongs to complicated engineering. And its expression is through complicated surgery conducted in hospitals. And you've got the best teams. If you're getting a really good surgeon, these guys are better trained than a heart transplant surgeon. Yeah. And they've got big teams and they've got big reputations, and they run entire states of USA or countries in Europe or whatever, because they are the central figure and they run everybody. And if you're not going to those people, it's because either you're intimidated or the bloke who's your dentist 3 doors down is saying, I can fix this with a splint in your mouth. It's just like, what? Are you kidding me?
And you're talking about maxillofacial surgeons.
Well, there are lots of people that can call themselves surgeons. It's only surgeons. The title of being a surgeon isn't like saying I'm a doctor. The title of surgeon, anyone can call themselves a surgeon. The bloke who cuts my tree calls himself a surgeon of trees. my veterinary surgeon is a veterinary surgeon. A dental surgeon is a dentist with a bachelor of dental surgery or doctor of dental surgery. They're cutting teeth, right? So that title of surgeon is used by everybody. And and if I'm an oral surgeon and I want to attract you to my cause, I'll call myself an oral and maxillofacial surgeon. I've got plastic surgeon colleagues who say that they practice maxillofacial surgery, and you go, not very well. You just you're not the top of the tree. You're just somebody trying to do something else.
Sure.
The majority of maxillofacial surgeons take out wisdom teeth. That's not a person who does jaw surgery 100% of the time. That's a person who takes out wisdom teeth 100% of the time, and 0.1% of the time might do a jaw surgery operation. So if you're going to really discriminate who you should be going to, it's an orthodontic surgeon, who 100% of the time does orthodontic surgery, and who invented the operations or invented the conditions because simply they've got so many patients out there that simply want 100% of the time to be 100% cured of a 100% disease. Orthodontic surgeons. So don't even discriminate calling themselves maxillofacial. You say, are you an orthodontic surgeon 100% of the time? If you want that to be the discriminating question, make it that one.
And is that what you are?
That's what I am, yeah. And I'm not a neurosurgeon. I'm not a foot surgeon. I don't operate on shoulders or eyes or ears. All I do is jaw correction surgery for the treatment of people with small jaws. And the secondary effect of that is sleep apnea. And they want that sleep apnea also gone. And they also want to look amazingly amazing. Not like me, obviously. I wish I could have had it. And they want to get out of braces. In fact, they never ever want to have braces ever again. They've been tortured for it for years, and they never want to wear a splint. They want to stop snoring. They want the brain fog to lift. They want to get on with their lives. They don't want to have attention deficit disorder anymore because they're sleeping in class and taking Ritalin to wake themselves up. They simply want to delete these 10 other diseases that everybody thinks they've got. And they haven't got 10 diseases. They've got one disease. They've got a small jaw. They want it gone.
Why did you never have jaw surgery? Do you think you're a candidate for jaw surgery? I think I might be. I mean, my airway definitely still collapses in my sleep. Just 2 days ago, I was having a nightmare. It was about 5 a.m. I do this weird thing. It's actually not that weird. Apparently, it's quite normal where I wake up about 3 a.m. I'll be up for an hour. I'll read.
Yeah.
If I'm bad, I'll go on the computer and I'll get myself extra ramped up, and make it even harder for me to go back to bed. But then I'll usually go back to bed around 4 or 5 for another hour or two. So I went back to bed about 5. And then between 5 and 7, while I was asleep, I had a nightmare where I had this nightmare that my throat was slit. And
Yeah.
I was walking around showing people, and I was saying, I can't breathe. I'm so dizzy. Help me. And then I woke up and I was just on my back like this. Right. So I think that the airway collapse fed into this dream of me having my throat slit and feeling like that's why I couldn't breathe, but really I was just choking in my sleep.
Well, what you're saying in your language is so common. It is so endemic. The experience of waking with that feeling of choking, that ball in your throat. Historically, by the way, that's called globus hystericus. Globus hystericus. It was always related to middle-aged women. It's that tissue flaccidity, that flabby skin on the inside of your throat that's collapsing and closing your airway. And the only way that you can maintain muscle tone is either you're awake or you're in light, restless sleep. You're moving around a bit, you're restless. And that light sleep doesn't allow you to dream. And what you were describing were hypnagogic and hypnopompic dreams. They're vivid, they're almost nightmarish, they're quite lucid. And the weird dreams that occur in light sleep, the dreams that you get in deep sleep, where you're completely flaccid and completely relaxed, they're very pleasant. And the way that your brain organizes the information that you've received during the day, and you wake up and you're refreshed and you've had a good night's sleep. So what you're saying, that wake and sleep cycle with vivid nightmarish dreams and that feeling of choking, they're not separated conditions, they're the same thing. And you can explain them scientifically simply by reading books on sleep and dreaming and brainwave activity at night and motor restlessness. But patching all of that together, I mean, who's there to explain it to you? Your GP? Your dentist?
Mm-hmm.
No. It's the bloke who all he does all day, every day, is treat people with sleep apnea, not CPAP machine, not with a bit of acrylic in your mouth, but with a 3D CT. They segment you, they put you into multiple pieces, they break you apart, they look at your airways, they look at your flesh, they look at your tongue, they look at your bones and teeth and everything. They put them all together in a digital environment, they put apart, they rearrange the parts, and then they say, that's what I'm going to do for surgery. And then you wake up from the operation and you can breathe and you can sleep and you can dream normally and you breathe through your nose on your back, never collapsing. You wake up refreshed. That's the aim.
So fundamentally, what's my problem? Is it that I need to be? I mean, in short, I need to
Or,
be advanced.
cosmetically, looking at your front eye, you're a very handsome man. People would say, you don't need to have facial surgery because, I have a prejudice to believe that facial surgery is all about cosmetics. Well, but I would be looking at you as somebody who chews chewing gum. You've got big masseters. That's not telling how wide your jaw is on the inside.
Mm-hmm.
And I don't know how long it is, and I don't know the proportionalities and so forth. And so from looking at you, it's not about the subjective of how good you look,
Mm.
it's how well you function on the inside.
Mm.
And then when you make those rearrangements on the inside, of course, you're changing the drape of the face that surrounds you. Yeah. So you also want to be able to manage that environment simultaneously. And of course, you've got a bite in the middle. You want to be able to chew and function and not have sore jaw joints and so forth. Well, you asked me before why I became an orthodontic surgeon. And I've got more degrees than you'll ever meet in any one individual in your lifetime. And I'm not saying that to fluff myself up. It was simply that was my method of inquiry as to my own condition. So some people go into online forums. Some people like yourself set up the online forums and the conversation, the platform for people to talk. But me, I simply going back to university saying, well, this degree does not answer my question. And I get another degree, and that did not answer my question. I get another degree. And eventually, it just led to me inventing things.
Mm.
And because I had enough degrees and enough what they call gravitas or imperium or presence to be able to say to people, listen to me. I know a better way to do this. We don't need to be stuck in the 1800s with leeches and cupping. We've progressed medically, and we don't need to be stuck in 1898 when orthodontics was first invented, all premised upon removing teeth because you had too many teeth and having braces. That is a redundant and old technology, but we still live with it, just like we live with chiropractic philosophy, just like we live with osteopathic philosophy, just like we live with acupuncture. We say it's been around for 2,000 years. It can't be wrong, right? But it can be wrong.
Hmm.
That's called science,
Yeah. And now we have the ability to cut jaws into the pieces we need to and rearrange them to get to the root of a lot of the morbidity that people are suffering from.
Exactly, exactly. You've got to stop thinking of the face as a collection of bones. It's not. You don't see my bones. I don't see yours. They're imaginative. I can print them, I can image them on an X-ray, but that doesn't make them real. What's real is you, the whole thing,
Mm,
the skin on top of you, the flesh inside you, the airways that are living within those tubes, yeah, the brain
mm,
that sits on top of it that has to be hormonally balanced and in equilibrium, that sleep wake cycle that has to be perfect
mhm,
every day in a
mhm,
constant series called life. And we all age. I know it in myself. And if you've got something that's an error right at the start, it just magnifies as you get older.
mhm,
And so,
mhm.
so the aim is not to treat sleep apnea.
Paul, hang tight. Oh, I'm interviewing a surgeon right now. Hi. That's
Hey,
my,
how are you?
he
That's your
said,
new wife.
yeah, that's my wife. Yeah.
Congratulations, congratulations. It's only been a week, right?
She couldn't hear you. Yeah, that's okay. It's been a week. He says congratulations, hon. She says thank you.
It's
She's just off her shift at the hospital and was probably wondering why I wasn't, you know,
right.
in the
She's
big
just
house.
yeah, yeah. She wants you in the bed. Yeah,
Yeah, she does. She does. And she definitely doesn't want me getting jaw surgery. So just to come back to my dream the other day. So I woke up, I said, "Hun, did you hear me snoring?" And she said, "Yeah." I told her about the nightmare and I said, "See, hun, this is why I need jaw surgery." And then
mm,
just sort of busting her chops, I said, "Aren't you excited to see my new face? You're not even going to have to you're not even going to be able to recognize me. You're going to have to take me to your family and say, 'Oh, this is Ronnie. How do you like his new face?'" And then she said, she freaks out when I joke like that, and she says, "You're not getting jaw surgery. No, no way. I hate when you say that." But this is the struggle, right? Like,
yeah. The consciousness of what is jaw surgery. The most basic operation in jaw surgery is having your wisdom teeth out.
hmm.
You're
Say that
still
one more
going
time.
under the most basic operation in jaw surgery is having your impacted wisdom teeth removed,
Mm,
right?
mm-hmm,
And that created an entire specialty of dentistry called oral surgery. And that one operation, how to take out every variation of impacted wisdom teeth, is the foundation for jaw surgery that you call corrective jaw surgery. And that's why it is that you go to an oral surgeon who takes out wisdom teeth to do the corrective jaw surgery. Right?
right,
That's
right.
how it has been traditionally. Yeah.
So in a
But
sense,
orthodontic,
the whole field is kind of built on this sort of twisted foundation of, dare I say, making things worse. I mean, how do you feel
right.
about wisdom tooth removal? I know that
Well,
in some of your
the
IMDO
question,
videos, you talk about how IMDO can often allow wisdom teeth to erupt more
hmm,
naturally and in a healthy way if the space is
hmm,
created. But
yeah,
then I interviewed Dr. Mariana Evans, who's a orthodontist, who said that there's no evidence that removing wisdom teeth negatively impacts jawbone. So I definitely pushed back against that and said, well, that's not my intuition. But how do you feel
well,
about that?
the other argument that they pose is they say, well, evolution has made our wisdom teeth redundant. Have you heard of that one?
Of course, yeah, yeah. She would
Right.
not
Have
say
you?
that.
Right.
She's studied the Morton skull collection and has very famously said that the old skulls all have 32 teeth, and that
Hmm.
it's a modern phenomenon that we've lost our teeth, and it's not because of evolution. It's because of probably environmental causes that our jaws have gotten smaller and have been unable to accommodate the teeth.
Mm.
But she would not admit that removing the teeth can make the jaw worse over time. My thesis is that the wisdom teeth are like concrete footings for the face. It's like when you're building a house, you have
Mm.
the concrete foundation wall, and then under that you have another piece of concrete that the concrete wall sits on, and that's the piece that's way deep below the frost line that can't move, and that's
Yeah.
the cornerstone. Um,
Well, hold up your fingers. How many fingers and toes have you got?
10 fingers, 10
Okay.
toes, fortunately.
Which is the most useless amongst them?
Uh, Definitely the pinkies, but I would miss them. I certainly wouldn't want to lose them.
What about your little toe?
The little toe I could do without probably, but if I had a choice, I certainly wouldn't want to do without it.
So let's have a philosophical conversation about your little toe.
Okay.
Yeah. I'm a surgeon, and you're coming to me to have your little toe removed. How much are you going to pay me to do it?
Whatever you ask.
Well, you probably wouldn't pay me to do it at all. You're not
No,
going to have it removed. It's just part of you, right? You're not going to
why would I want to
prophylactically
pay?
remove it.
Yeah, why would I want to pay to have a piece of my body amputated?
Right. Okay. So
And
I'm a
I'm a
surgeon.
runner. I run every day, and I run in toe shoes, and if I lost
Right.
my pinky toes, now I have a little piece of rubber flopping around on my toe shoe. The pinky slot is going to be
Yeah, but
unfilled,
you
and that would
don't
suck.
really
Maybe
need it. You don't.
maybe my
It's
balance.
an evolutionary redundancy. Evolution has decided that you don't need it. I'm a surgeon. I really want to remove your little toes. I'm so passionate about it that I'm going to pay you to allow me to remove your little toes. You won't pay me, but I'm going to pay you. How much are your little toes worth? How much can I pay you to allow me to cut off your little toes?
Now I'm really freaked out because if you're paying me to cut off my
Yeah.
little toes, as a cynic, especially a cynic of the medical world, I think that that's a
Mhm.
huge red flag.
Yeah.
To
Okay.
me, I could go down a
But how
rabbit
much?
hole with that, but if you're paying me,
How
that
much?
means I'm the product somehow.
Right. So I'm going to pay you to remove your little toe. Is it worth $10? Can I give you $10 for your little toes?
For to remove my little toes, I would probably do it for 50,000 a piece, not less.
50,000 a piece. 50,000 for one toe and 50,000 for the other. $100,000.
I'd consider it.
You consider it, but
I would
okay.
not. No, I'm a runner. I would not consider it. I
Okay.
could because
All
that
right.
could
Okay.
destroy
Well,
my running.
it's obviously 100,000 isn't enough. Well, let's go up the ladder. $1 million.
Maybe.
Maybe. Yeah, but
Maybe.
you're still debating here a little bit. I think.
For
Let's
sure.
take 10 $10 million. I want an absolute yes. No, definitely $10 million.
I can't give you an absolute yes.
All right, okay, you're still debating it. $100 million.
I don't know if there's any number that I would
There's
pay to
no number, is there? There's no number. So in effect, what you're really saying, however useless everybody says your little toes are, to you, they're priceless, right?
I think so.
But how much would you pay me to remove your wisdom teeth because I told you they're evolutionarily redundant?
I think when I was 11 years old, my parents probably paid a couple stacks to have my wisdom teeth removed.
Aren't they a part of you?
They were. Now they're in some landfill somewhere, probably.
Right.
Yeah.
Who won
And I
that
miss
game?
them all the time. Sometimes I sweep
Yeah.
my tongue up onto the roof of my mouth, and I meditate on the fact that I only have 24 teeth,
So
and
let's
it
talk
freaks
about
me out.
let's talk about how many body parts you've already lost. You've lost teeth, you've lost wisdom teeth.
My
What about
appendix
your appendix?
gone.
What about your tonsils?
Still have my tonsils. They wanted to take my tonsils, but somehow I fortunately
Because well,
avoided that.
because you don't need your appendix, you don't need your tonsils, you don't need your adenoids, you don't need your wisdom teeth, you don't need these extra teeth, premolars. Yeah,
I'll give you another one. I'm circumcised, so my foreskin,
yeah. I lost my foreskin too, and
and that
I
it
regret it.
sucks. I mean,
Yeah, I know. It was just
I don't
taken
think
away.
I'm not as negatively affected as some people are by my circumcision. I had a guy come on my channel, and he gave me the whole download on that, and that for some
Mm.
guys is a horror show.
Terrible.
They have
Now,
complete sexual impotence.
I notice that you've got hair, but I
Yes.
don't. I would prefer to have my hair. In fact, I'd prefer to have my wisdom teeth, and I prefer to have my premolars, and I prefer to have all the structures in my nose and back of my throat that my ENT surgeon removed. I prefer to have all those bits of my body that every surgeon says, pay me to take it out, right? That's a kind of surgeon that you do not want to meet.
Mm.
The kind of surgeon that you want to meet is you don't have an arm, and this surgeon says, I'm going to give you an arm. I'm not the guy who's going to cut your arm off. I'm going to give you back your arm. Yeah. I want my eye back. I want half my brain restored. But those surgeons don't exist because it's impossible to grow back an arm. But the moment you say it's impossible, you stop looking. And the moment people say you don't need your wisdom teeth, it's because you stopped looking for the reason why they get impacted. And the moment you can discover the reason to make sure that they can grow normally, every bloke on the planet who takes out wisdom teeth is going to object, right? Because they have to
Yeah.
relearn their trade. Yeah.
Well, someone told
It's
me
like
that with third molar removal is a multi-billion-dollar industry. I think it was somewhere between 5 and 10 billion, maybe somewhere between 3 and 5 billion in the U.S. alone, just chucking
it,
thirds.
it, it drove the opioid crisis. All those guys on fentanyl and all the opiates in Philadelphia and Pennsylvania and Vancouver, all those people got addicted to opiates. How do they get addicted to opiates?
Post surgery.
Post surgery. And the commonest operation,
Yeah,
wisdom teeth.
third molars. Sure.
And we know that story of how endone or oxycodone became the addictive drug for all these young people was because they were given over prescriptions for their wisdom teeth surgery. That was the big driver for it.
Really?
It's a terrible story.
Mm.
You know that how pharma was allowed to um, falsely represent the dosage and effectiveness of that very highly addictive narcotic, and now we're stuck globally. Throughout Europe and North America and South America, we're globally stuck with the opioid epidemic that all started because you had corporates that knew how to make a profit from a drug that they didn't have any way to sell or market or make a profit from it, apart from the misrepresentation of its use.
Mhm.
Yeah.
Mhm. Yeah, yeah, the cat
So
was let out of the bag,
right.
and now we have
No,
generations of addicted people that can't live
generations that
without
just
painkillers.
can't get off it. These are the kids of parents who paid for their children to be looked after, and 3 years later they're homeless on the streets. Just walking like zombies,
Yeah.
and no one talks to them to find out their stories because you all think they're homeless and they're a bit creepy and whatever.
Well,
Yeah,
these guys are so messed up, they'll if you let them in too close, a lot of times they'll steal from you so that they can go out and, pawn off whatever,
buy,
your
buy more
PlayStation
drugs. Yeah,
5 so that they
yeah,
can buy more pills. Yeah, my
yeah.
area is a hub of the opioid crisis. Obviously, Purdue Pharma, who manufactured the original
Purdue,
OxyContin,
Purdue. Yeah,
they're local
it,
to
it,
here. They're in Connecticut.
yep.
Tufts University, where I was a student, is the medical school that was influenced by the Purdue family donations.
Mm,
They had buildings named after them at Tufts,
mm,
and they somehow infiltrated the Tufts medical education to promote this zero pain sort of philosophy. Oh, a patient should never have to feel pain, and get
mm,
all these studies published that demonstrated, right, with bunny ear quotes, demonstrated that, OxyContin is not addictive. Somehow, I don't know
mm.
how the hell they did that, but, I'd love to see the how that study
Sure.
was put together, but no, you're right. You're right, and
No,
it all I didn't know that, third molar extractions was like a leading
that drove it.
uh,
Yeah,
drove the
that drove it.
prescriptions.
That drove it in young people because young people don't have diseases. They're young.
Mm, mm.
They have impacted wisdom teeth and they're getting prophylactically removed, and they're all having it validated through this argument that you have to have them removed, rather than having treatments that fundamentally look at the entire body of whatever. If you've got impacted wisdom teeth and they're pathological, yeah, sure, you have to have them removed. But the prophylactic removal of wisdom teeth, that's an enormous argument in the scientific, or the dental scientific press, because of the health economic costs of that to a government that's offering those services through public health facilities. They'll say, what? We've got to pay for prophylactic removal of wisdom teeth? Why do we ever develop them? And that argument that evolution has caused it, or dietary change, that's the most ridiculous argument of them all. It's like saying we've all got white skin because we all live in houses and not going out in the sun. There's a very fundamental reason as to why we have impacted wisdom teeth. It has nothing to do with soft diets, and it has nothing to do with evolution. But
So
that's for a
what is it?
conversation as we. Oh, no,
No,
we've
I
got to
mean
leave topics. We've got to leave topics. We've got to leave topics to discuss, right? You know,
okay. Sure,
we've got to
that's,
we've got to we've got to we've got to we've got to build your audience inquiry and get them to give what they think should be the questions to answer.
Sure,
Yeah,
and why don't folks leave a comment below as to why do you think we have impacted wisdom teeth? I'd love to hear what the
yeah.
audience thinks about that, and then maybe also a question for another day is what can we do to save wisdom teeth in young people? That's
Well,
the $1,000,000
well,
question.
I'll put it to you this way. I'll put it to you this way, and I get this all the time, because I treat a lot of kids. I've got a little glass, and I've got a big glass, and it sits on my desk, a little one and a big one, and right in between them, I've got 32 jelly beans. Now, do you have jelly bellies?
We do.
Yeah, right. So 32 jelly beans. 12 of them are the delicious jelly bellies. Yeah. And the other 20 are the bigger jelly beans. And they're all red, and no flavor to it. They're all the same. And I take the big glass away, I put it to the side, and I give them the small jar. And I say, I tell you what, you're looking at my 32 jelly beans there. You can have as many of them as you want, but they all have to go in the glass. And they go, great. And they get the 12 jelly bellies first, and they put them in the jar, and then they try to crush in as many of the bigger jelly beans, the red ones, on top. Yeah. And deliberately, there are 8 red jelly beans that can't fit in the glass. But they don't care. They've got the 12 jelly bellies. They've got, at least 10 of the others, or 12 of the others. And I go, are you happy with that as an outcome, that you only got 24 jelly beans? Yeah. And they go, well, Paul, you only gave me the small jar. You only gave me the small glass. Why don't you give me the big one and we'll play the game again? So I give them the big glass, and of course they get the 12 jelly bellies in. They get the other 20 bigger beans in. Now they've got 32 jelly beans in one jar, and they go, I get to take this home. And I go, and that's how IMDO works,
Wow. You're giving them the big
right?
jar.
You give them a big jar.
Yeah.
Otherwise, you can't fit them in.
Mm.
Yeah. And if I give them the big jar, they don't get sleep apnea either,
Mm-hmm.
ever.
Hmm.
And they
Hmm.
look good.
Yeah.
It's about keeping the furniture in the room. You don't get rid of the furniture. That's your anatomy. Simply because someone says you don't need their chair or table or old TV, yeah. Once it's gone, it's gone.
Mm.
You don't get it back.
No. No, you don't.
So if you've got a claim that people are making your jaws bigger, yeah, you know that it's not true unless you get to keep 32 teeth.
Hmm. Hmm.
Yeah.
Sure. But what about?
You know it doesn't work unless you're never going to get sleep apnea or snoring for the rest of your life. You know it hasn't worked if you lose your tonsils. You
Mm-hmm.
know it doesn't work because you still look like you've got a small jaw.
Mm.
Yeah. That's how you know.
Mm. Mm. What about the maxilla, though? I'm sort of dragging us back into the technical domain, but you said IMDO gives you the bigger jar, but IMDO gives you the bigger lower half of the jar. But what about the lid?
Well, that's surgery. That's
Mm.
about making the upper jaw bigger three-dimensionally.
Mm.
And IMDO surgery too. Remember I said to you, so is wisdom teeth surgery. That's jaw surgery too.
Mm.
Yeah. So when people say you don't want to have your jaws operated on, well, count the number of operations that you're having already. Tonsils, adenoids, wisdom teeth, premolars, years of orthodontics, splints, and then you've got all the treatments of sleep apnea. You've got the treatments for diabetes. You've got the treatments for weight gain. That 300 kilo fellow that's walking down the streets of Louisiana,
Mhm.
is he fat because he snores, or does he snore because he's fat?
Yeah, that's the modern day chicken or the egg question.
Well, association's not causation,
Hmm.
but being fat can aggravate it. It doesn't cause snoring.
But snoring can
Yeah,
cause weight gain through ghrelin and other appetite hormone dysregulation.
exactly. Just by waking up and not having the energy to even get out of bed.
Yeah, I just went through that. So I was married last weekend. I stayed up late on the night of my wedding.
You can't tell me what's going to happen on your honeymoon.
Well, so I'll tell you a small piece. So
Yeah.
the next day, I went to bed at around 1 a.m. the night of my wedding. Unusual. Usually I'm in bed around 9. The next day, I was a little out of sorts naturally, and I just
Mm,
had this insatiable sweet tooth. I mean, I just could not get enough. Um,
mm,
Cake, leftover cake from the night before, and it was like there was that discomfort that was in my body from not having slept a normal night's sleep. I
mm,
was trying to scratch that itch with food. And I
mm,
said to myself, okay, this is what they mean when they say bad sleep can cause people to get fat.
mm. Well, it's not just about getting fat aggravating, it's putting on muscle. And the more muscle you've got, the bigger your neck gets too. And the bigger the neck, could be through fat or through muscle, the smaller that donut hole in the middle gets too, and the more
Mm,
collapsible it becomes.
mm,
So it's a mixed phenomenology, um, but uh, but again, these are just aggravators of the underlying condition.
mm,
Um, so you, jaw surgery to treat sleep apnea, that's one aspect of jaw surgery. Another one is to treat the effects of having a small jaw, like impacted wisdom teeth surgery. That's jaw surgery. And then there's a third type of jaw surgery, which is to prevent wisdom teeth removal and to prevent sleep apnea, right? That is the panacea. That's the goal. If you can prevent everybody getting sleep apnea by doing something when they're young, that's like giving them a vaccine for polio.
mm,
So if you don't have a vaccine, everyone's in an iron lung. And to get an iron lung, you've got to have a factory. And you've got to have people trained and machinists, and you've got to have doctors and nurses in universities to monitor these kids in iron lungs. All of that, all of it is redundant the moment you create a vaccine for polio.
Is
Yeah,
that the problem, that there's so much of an infrastructure that's built around sickness?
Purdue. Yeah.
So what does that portend for the future?
Was that the name of the opiate company? Was
Yeah, Purdue Pharma, the Sackler family,
Purdue Pharma,
out of
the
Connecticut.
Sacklers? Yeah,
Yeah.
all the universities.
Yep.
Would they have created their fortune if wisdom teeth exist?
No. No, they wouldn't have.
All right.
But then, so does that mean that there's always going to be this entrenched resistance to true health, true airway health?
Obviously.
It's not just a matter of knowledge and training, it's a matter of overcoming a well-funded, organized resistance to people actually getting truly healthy. Yeah, that's sad.
Yeah. So prevention, the drive for prevention of a disease, recognizes that the consequences of having that disease are serious. It recognizes that you're vulnerable to the disease, that if you get the disease, you will be seriously affected by it. And it recognizes too that there must be a way of preventing it. Yeah.
Hmm.
You have to tick all those boxes in order to drive the science of creating the knowledge to cure the disease before it happens. Yeah.
No doubt, but that work is done. I mean, it's like, listen, what you do is
What what
incredible.
what jaw, what jaw surgery exists that can actually prevent you having wisdom teeth removal and prevents you having sleep apnea and gives you a perfect orthodontic bite with 32 teeth? What other treatment exists?
IMDO.
Really?
The concept, I'm following. Follow me for a second. The concept
Mm,
that the problem that we have fundamentally is that the jaw is too small and that we need to make the jaw bigger. It's not
mm.
that complicated.
Three-dimensional. It's turning a rabbit into a dog. It's
So you're saying it is,
three-dimensional.
so you're saying it is complicated. You're saying that the reason it's not more prominent and popular that these procedures are done is just because it's difficult to do. What I'm trying to suggest is
It's
you've
not
made.
difficult to do. It's just difficult to imagine. And because it's difficult to imagine, and all of us go to universities to read books written by others who have preceded us in prior centuries, there's no actual inquiry as to the discovery of something new. There's no stimulus to do it. We're all stuck within the culture of what trains us. Yeah. And so ultimately, you have to be able to stand ahead of the crowd. You've got to be the Galileo. You've got to be the fellow like Einstein or whoever, the Elon Musk. He just stands up and says, just do it. This is the new way of thinking.
Mm.
And then with time, everybody believes in relativity. Everyone believes in electric cars. Everybody believes that gravity exists or quantum mechanics. But at some point, these things were unknown.
Mm.
And it relies upon intelligent people to make the communications available and to reduce the complexity of the conversation to something that a meaningful person can understand. That's what it needs.
But is that really
Someone like
enough?
you.
Well, thank you. But is that really
Yeah.
enough in a world where we have potentially malevolent forces that are trying to organize to keep people down?
Just give them a different preoccupation of making money. So to stop pharma selling opiates, you say, well, sell anti-cholesterol drugs.
But those
Do
might become
something
obsolete
else.
too if people start sleeping
Uh,
better,
yeah, yeah, yeah. You're right.
right?
Yeah.
Maybe we sell them on the idea that people will need opioids after jaw surgery too, after orthodontic
Yeah.
surgery.
Well, there's nothing wrong with opiates so long as they're medically administered and they're supervised. Where it goes wrong is where the marketing for that becomes corporate and profit driven,
Mm,
and and premised upon giving incentives to doctors to prescribe these things.
mm,
That's where it went really bad. But we're all people. We're all individuals. We're we don't get up in the bed in the morning wanting to kill and murder and plunder and rape. 99.999% of us are just good people, and I doubt anyone maliciously thought that their actions of driving a profit would lead to a mass opioid crisis, but it did. You know, um, so either we can blame them, or as a collective community, we can say, a global community, say, let's not do it again. Let's eradicate the situation which enabled that to occur in the first place.
mm,
It's just about living life. It doesn't have to drive you 24 hours a day with this obsession to change the universe. Just waking up every day, just want to be a better person and help
yeah.
an endless stream of people becoming healthier and better themselves. Yeah.
Mm, mm, mm.
And that
Yeah.
conversation, well, you're modifying it. You're the moderator of it, and you're the stimulator. You're the protagonist, and that's fantastic. The world needs more people like you.
Well, I appreciate that, but what the world really needs is more people like you who can actually do these procedures. One of the questions that the Discord server wanted me to ask you is there anyone else in the world who even does IMDO? Which is sort of to my point of why are these procedures so rare if they're
Oh,
so obviously beneficial
yeah,
and potentially not that,
corporates,
yeah.
corporates, corporates, and I'm very happy to go through all of that with you in another discourse, and I can explain it to you till the cows come home.
Hmm. Hmm.
Corporates.
Mm. Mm. Yeah, we have a lot to talk about going forward.
Yeah.
Yeah.
Thank you so much for talking to me. I really appreciate it.
No, thank you for your time. And you're in Australia, so it's about 10 a.m. your time. It's about 8 p.m. my time. Have a good day.
All
And
right. Thank you.
uh, things we'll talk about in the future, a technical deep dive, possibly into IMDO and other orthodontic procedures. Maybe we answer the question in the future of why don't wisdom teeth fit in most mouths anymore,
Mhm.
and other such questions that you and I are both interested in and that you have answers to.
Thank you. Thank you for letting me be able to answer them.
Sure. All right, doctor. That's it for
All right.
now.
You have a great day. And thanks to your audience as well. I'm sure they're lovely people. And you're a lovely guy. And congratulations on your wedding. And I believe you're going to have a baby down the track
Yes.
in
Yes.
8 months and 3 weeks' time.
Yeah. uh, no, I'm a sinner. I'm a sinner. I'm having the baby uh, next month. Um,
Right. Oh, it's quite. Well, that's a short gestation, isn't it?
I
Oh,
could
that's
tell you
fantastic.
about the struggle that we had to get married in a Catholic church, but actually it wasn't too bad at all. The priest was very accommodating and was
Mm.
just happy to see a young couple that was actually getting married and having a child. So, it's
Well,
been
if the
it's been
Catholic Church can, if the Catholic Church can change, so can orthodontics. There you go.
That's awesome. I love that.
All right. All right. Well, you have a great day and enjoy sunny Connecticut,
Massachusetts, just north of Connecticut.
Massachusetts. Right.
Yeah.
Enjoy sunny Massachusetts. I'll get to
Thank
the
you.
beach. Catch you later.
Indeed. All right. Cheers, doctor.
Bye-bye.
Bye-bye.
Bye bye bye.